Good afternoon, folks. This is Dr. Teresa Anderson. I am owner and operator and practicing psychiatrist of the Anderson Clinic in Cincinnati, Ohio. We specialize in treatment-resistant depression, anxiety, and PTSD using outside-of-the-box treatments. Today, I am fantastically looking forward to our guest who we're going to be chatting with for our podcast on Psych Waves. I'd like to introduce Dr. Brittany Panico, who is an adult rheumatologist in Arizona, and she's going to be telling us a little bit about her practice and what she does, and how there are a lot of comorbid conditions that exist with the subset of population that she sees. So, Dr. Brittany, thank you for coming.
Thank you, Dr. Anderson. Thanks for having me. I'm excited to be here.
Fantastic. So, rheumatology, tell us, for those of us who don't know, what all that is, what type of practice of medicine that is.
Of course. So I practice adult rheumatology. So I see adults 18 years and older. And rheumatology encompasses the vast majority of what we consider as autoimmune conditions. So when we think about that, primarily we talk about rheumatoid arthritis, psoriatic arthritis, lupus, and there's a other group of subset conditions called myositis or inflammation of the muscle tissue. Vasculitis falls in the rheumatology category. And then I also treat osteoporosis and gout. And then expanding my practice to thyroid eye disease this year, I'm excited to bring that into my practice. Um, the autoimmune things that rheumatologists tend not to treat are actual autoimmune thyroid disease and MS. So those are common autoimmune conditions that we don't see. But most of the time, we'll see patients that encompass any of those conditions.
Are those handled more by subspecialists, endocrinology people, that sort of thing?
Yes, and neurology will treat MS, exactly.
Okay, excellent. And so essentially, autoimmune diseases can happen whenever the immune system is attacking self and it's recognizing it as foreign or other. So it's almost as if it's treating as if it were a virus or a bacteria or something that it's not supposed to be there, right?
Yes, exactly. So when we think about the immune system being overactive inside of our own body, so it starts causing trouble within certain organ groups or within the joints. For example, with arthritis, people can get damage and inflammation to the joints. And then the other conditions, they can affect the organs. Like lupus commonly can affect any organ in the body, including the brain and neurologic system.
So how do you deal with that level of inflammatory response?
It definitely requires a team. So most patients who have a rheumatologist also see some other kind of specialist to help manage whatever organ is involved. So of course their primary care doctor. And then depending on what else is going on, they might have a nephrologist to help with their kidney function. They may have a cardiologist, a psychiatrist. And so we definitely use a team approach. And for the most part, we use medications to help calm down the immune system and regulate things so that we can decrease the inflammation and decrease the immune system from being going so haywire. Um, there's a lot of focus on restructuring our diet and using lifestyle modifications to help with that. Those things don't take the place of medication, but they definitely help augment how we use our treatment. And as we know more in modern medicine, the connection between the brain and the gut, and then the immune system and the gut. So our gut health or microbiome that live inside of our intestines is really important as we manage these conditions. And also just to help us feel better overall. A lot of times medications, as in psychiatry, will try something and somebody may not feel that that's the best fit for them. And so in rheumatology, we often, talk a lot about having, trying multiple things. If you don't feel well after the first medication, that we talk about it and try something else. So I think there's a lot of overlap with, how you may approach your patients as well.
Absolutely. You'd mentioned oral medications. What other options are there for folks who are suffering with autoimmune diseases?
So we do have oral medication options for certain types of things, and then also subcutaneous or injections that you can do yourself at home, either through like a pen mechanism. A lot of times we equate that to how an EpiPen works. And then there's infusion medications where you come in and get medication delivered through an IV. So certain conditions, those may be more helpful.
Okay. Do you find when you're trying to sort of turn the immune system down that folks might be prone to getting other types of infectious diseases?
Yes, that is definitely a risk that we talk about with our patients because, like you mentioned, as we calm one part of the immune system down, that may lend itself to developing other types of infection. So, we do pay a lot of attention to tuberculosis. So, we make sure that we screen our patients for things like tuberculosis and hepatitis. Here in Arizona, we also screen for valley fever. So, depending on what part of the region you're in, you may have to be screened for certain kind of fungal infections as well. And so, if somebody does have an illness or gets sick while they're on these kind of medications, then generally we hold a dose or may skip a dose until you recover from that infection. But it doesn't necessarily make you not able to take them per se. So we're really careful with, how we approach patients who get things like pneumonia or even just sinus infections, that we don't suppress your immune system too far that you can't recover from those things. So a lot of that just requires regular follow-up and communication with your medical team to be able to manage those if that happens.
That makes a lot of sense. And I know too, a lot of my asthma patients also have comorbid anxiety. And so sometimes when they wind up in the hospital, they wind up getting a course of steroids, which can help with the inflammatory response, but also can increase their anxiety, sometimes even leading to psychosis. We've seen folks who actually hallucinated or had delusions or wound up manic or not sleeping for days with the steroids. They can be pretty harsh when it comes to the mood situation.
Yes,
Did
definitely. And that's something that in my practice I'm really cognizant about and do talk to patients if they're on or being given steroids. So typically a low dose like 5 milligrams of prednisone shouldn't necessarily affect the mood, but everyone is different. So when we say that it typically doesn't, it certainly can in some people. But I do talk to my patients about if they're on steroids and they notice changes in their mood to let our office know, because that's something that we definitely want to address and not send you home with a medication that can make you feel worse than the condition that we're treating. And then also doses 10 milligrams and above, typically we see it more with 20 milligrams and above, but like I said, any dose can affect anyone. So I do definitely talk to my patients about that effect on their mood. um, with asthma specifically, the pulmonologists tend to use a little bit higher of doses than we use in rheumatology, but again, any dose can affect any person. Another thing to kind of piggyback what you were saying is when we treat patients in the hospital, we usually give them higher doses. And we do notice that the longer somebody is in the hospital, the more likely they are to experience mood changes with steroids, because you're out of your environment, your familiar environment, you're in a stressful situation. You're often confined to a room that may or may not have any windows or any way to see your external environment. And so that is something that is, I would say it's more common than we actually admit and practice. It happens to patients when they're in the hospital. But I
Oh, for
really
sure.
do try to be cognizant of that for my patients when I prescribe prednisone. But you're absolutely right.
Yeah, we normally see it in the like longer taper or burst doses of the higher doses, like 10, 15, 20 milligrams and above. And that's when we're like, ooh, you are not doing well mood wise.
Yeah, yeah.
Um,
And that's when we really appreciate the team approach as well. So, if we get a call
absolutely.
from another physician, about adjusting medication, that's a lot of value as well. So we always appreciate that if somebody notices something that maybe the patient isn't communicating to us.
Mhm. Absolutely. there's so much overlap between inflammation and disease processes. Just in the past few years, we've seen so many connections between cardiovascular disease and stress response, and emotional health and stress response, and like you said, gut health and stress response. Do you see frequently when um, your folks who may have depression or anxiety, when they're treated for their autoimmune conditions, that frequently the depression and anxiety decrease, and vice versa, when they're treated for depression and anxiety, a lot of their autoimmune and inflammatory responses decrease?
Definitely. I have seen that. And I think we underestimate the connection of our brain and the neurochemicals, the neurotransmitters that has to the rest of our body as well. So when the immune system is activated and our cortisol levels are higher for longer periods of time, then that actually turns into immune dysregulation, which produces more chemicals of inflammation, which then affect the brain and the neurochemicals in the brain. So when we calm that down or redirect it, so to speak, we definitely see more evening out of both
Mhm.
changes in mood and the immune system.
Mhm.
One of our more recent connections and something that definitely has a big link is psoriatic arthritis and things like depression and anxiety. I've had several patients who, once we treat their psoriasis and psoriatic arthritis and have them in remission, they've been able to come off either antidepressants or anti-anxiety medications, or at least decrease the doses. So that is has really opened my eyes to, the connection between that disease specifically and with mental health, and vice versa. I think the longer that patients are struggling with, you know how they feel, the more that they're in pain, the more they're struggling to stay in work, the more they're struggling to support their families, that then lends itself into the cycle of anxiety and depression as well. So when we have, when we target one thing at a time and try to simplify it, then it seems like the other things definitely tend to fall into
Cascade
place.
effect.
Yeah.
That's beautiful. That's amazing. Yeah, we've known for a couple of decades that at least depressed folks experience pain differently from folks who aren't depressed. If you stood beside a person who had depression versus not, and you hit both of them with the exact same amount of force, the person who's depressed is going to feel pain more than the person who isn't depressed. And um, it's amazing to me just the connections between, like you said, the inflammatory response, the gut brain health response. And speaking of which, we've had a number of folks who had high anxiety that wasn't easily treated with SSRIs, antidepressants, or even benzodiazepines, who, upon further history taking, we find that, they are really sensitive to a particular thing in their diet, like wheat or gluten or dairy or some such. And they've found that they've had leaky gut essentially. And once they eliminated those things from their diet that were causing them the problem, over a period of weeks to months, their anxiety also resolved too, which is phenomenal.
It is. It's incredible that connection is there, yet we pay so little attention to it as a medical community.
Absolutely. I think in medical school, we had all of two 30-minute lectures on nutrition. I mean, that's beyond ridiculous.
Hmm.
But so in an effort to try to educate our patients, we don't want to say there's a global ban on legumes or a global ban on fruit or a global ban on gluten or dairy, or it's very specific to the person, right? It's your
Exactly.
immune system, it's your gut, it's your health. And in that case, I definitely recommend people have like food allergy testing, sensitivity testing, just to make sure that they know is something that they're eating part of the cause of their problem.
Exactly. And I talk to a lot of patients too about just an anti-inflammatory diet approach. I'm doing a series on my Facebook page actually about recipes that incorporate anti-inflammatory philosophies. And just resetting your diet for as little as 10 days can make a big impact on the way that you feel. I think we've all had an experience where we've cut back flour, cut back sugar, cut back gluten, or some other irritating chemically substance, and noticed that we had more energy, we were sleeping better, we maybe had less aches and pains, but we don't necessarily equate that feeling to long-term
Right.
changes in our habits. Whereas if you're somebody who struggles with chronic depression or anxiety or chronic joint pain, like an autoimmune condition, there may be a little bit more motivation to really reset your dietary habits because that can provide a very long lasting benefit. So
Mhm.
I always encourage my patients, just pick 10 days where you can cut back or eliminate the best you can refined, processed carbohydrates, the white packaged things with the chemical sounding ingredients, and just really try, whole, fresh products,
Mhm.
fruits, vegetables, even eggs are okay. And and just give yourself 10 days to see how you feel, because I think that short period of time can really make a big impact.
Absolutely. In addition to the dietary changes and possibly getting tested for um, inflammatory markers or personal sensitivities, do you recommend pre or probiotics? And if so, what type?
That's a great question. So I do recommend probiotics. I think it's a little bit controversial because it's also an industry.
Sure.
Um, but the way that I kind of learned, and this is from a conference I went to called Healthy Kitchens, Healthy Lives, done by the Culinary Institute of America and Harvard's Public Health. And I heard a lecture where they recommended swapping out probiotics every month. So buying enough for a month and then switching brands and switching bacteria essentially. So the way I tell my patients is just pick whatever's on sale at your local pharmacy. It does not have to be expensive. It doesn't have to be refrigerated or fancy or purchased at a health food store. Just whatever's on sale and try it for a month. And then try a different brand, different version for a month. And do that about 3 or 4 times and see how you feel. And
Mhm.
you'll start to notice a change and see which ones you feel better with.
Mhm.
And then just cycle those through the year. It does not have to be, I mean, you can keep alternating, but you can pick 3 or 4 that you kind of cycle between. Um, and then also the best way without necessarily taking a pill or taking a probiotic is things like kombucha or like yogurt based products,
Like
kefir,
kefir.
or yeah, the fermented products, kimchi. Just adding a little bit of those things to your diet can also be as effective as a probiotic tablet.
Mhm.
So you don't necessarily have to buy anything, another pill. Sometimes we don't want to take another pill, but you can also incorporate those things into your diet just as well.
We attempted kimchi for the first time a couple months ago, and the first was an absolute disaster because it came out moldy, but just didn't do it right. But after that, it's like it's actually kind of fun to experiment with different tastes and different feels, and some things you like and some things you don't. But
Yeah,
it's nice
yeah.
to try to figure out, things that you could do at home that maybe could help your gut health and not have to buy yet another supplement too. So I love that idea of kombucha, of kefir, of homemade sauerkraut or
Hmm.
fermented vegetables, pickled vegetables, that sort of thing. I think that's a fantastic idea.
Yes, exactly. And they're really easy to just add into salad or add into whatever you're already eating. And sometimes we think like, oh, I don't know if I could eat a lot of that. You don't need a lot. You just need a little, small servings a couple times a week to
Mhm.
have that effect.
Absolutely. So, just out of curiosity, do you find that, say, people with long-term chronic autoimmune or inflammatory diseases, do they have like a maintenance regimen, and then if they're inflamed, then they have like a more intensive period of treatment, and then they kind of go into remission, or how, like, or is that just dependent on what it is that they have?
Sure. So sometimes it does depend on what they have, but typically when we first diagnose somebody, there'll be sort of this period where we find out what works, what you're able to tolerate without side effects. We don't necessarily use the term induction with rheumatology. That's kind of more of
Chemotherapy, sort of.
yeah, an oncology term. But depending on if you get a certain type of infusion, we may sort of give it that name. But typically, there's a phase where we're a little bit more aggressive with your medication up front. And then once you're feeling better and meeting essentially milestones of, being able to do the things that you want to do, minimal pain, minimal, joint stiffness. If it's organ function, we're watching your labs pretty closely. And then once you're in that sort of category that we define as remission, then hopefully we can maintain you with whatever medication that you're taking at that point. If there's flares in between there, then we may adjust medications, or that would be a time where some people may get some steroids sometimes. But the goal is that we get you into remission and you stay in remission. For some people, though, that doesn't always happen the first couple times, but our goal is that once you're in remission, then we maintain that. And depending on what condition you have, we try to get you into remission relatively within the first 3 months after we diagnose you. So the quicker that we can do that, then the more, benefit we have to maintain your joint health, your organ health. So
How insurance friendly are some of these treatments?
So that kind of depends too on the type of insurance. But most of the products that we use that tend to be what we consider a biologic. So when people think about things that they've seen commercials for, the sub-Q, the injectable medication or the IV medication, they do tend to be very insurance friendly because of the rebates that the companies offer. There's copay cards that we have available through the drug manufacturer, and each one is going to be a little bit different. But for the most part, we get patients on medication, very affordable.
Cool.
And then if there are issues with insurance, or if you're a patient who doesn't have insurance and is, somebody that we consider self-pay or direct pay, then there's ways that we can work with the drug company to help support that for you. So
Fantastic.
that's something that I talk a lot about with my patients, as well as, the affordability of medication, because if you're picking and choosing every month what medicine you're refilling based on your budget, we want to make sure that we're supporting you to be able to fill the medication that we're prescribing. So for
Excellent.
the most part, I would say they're pretty insurance friendly.
Awesome. I love your holistic and team approach, and it's so lovely to find another physician who doesn't want to practice medicine and avoid.
And it's
It
so lonely in a void.
is lonely. It is lonely, and it's scary because you have no other information, and that's just not cool.
Right.
So if you'd be so kind as to let patients know how they could get in contact with you if they're in your area, and let us know your contact info and your website address.
Absolutely. So I'm just starting a practice called Summit Rheumatology in Gilbert, Arizona. So I'm still in the early phases of that, but you can find me at Summit Rheumatology. And then I'm also on most social media platforms. So Facebook, Instagram. My handle is AZ, like Arizona, AZ Rheum, RHEUM, Doc, DOC. And you can find me there.
Arizona Room Doc. I dig it. All right. Well, thank you so much for your time, Dr. Panico. I really appreciate you answering our questions and how things like what you do are closely related to what we do, but it's all interconnected. I really enjoyed chatting with you today.
Thank you. I did too.
All right. Thanks, folks.
Thank you.